That's good. Perfect. Can you, but I want to know, can you tell me some, maybe introduce yourself, tell me a little bit about the research you've been doing, because, I came across your research and a number of things that I was doing, but then also you and your team and your colleagues have been in numerous newspapers just because of what you found about Black adolescent suicide.
Yep. So I'm an epidemiologist, and I run the Center for Suicide Prevention and Research at Nationwide Children's Hospital.
Mm-hmm.
I have been studying suicidal behavior in young people for about 30 years. Since I was a teenager, basically I volunteered at a clinic at the University of Pittsburgh.
Wow.
We became interested in this issue because there was a death in our region, in our area, of an 8-year-old girl several years ago, and a reporter had asked me how common that was, and I said it's very uncommon. You may see a child under the age of 10 die by suicide, maybe. I've never been aware of more than 10 times a year in the United States.
Mm-hmm.
But the suicide rates had been increasing in our country and among adolescents. And we thought, well, let's just look to see if there's anything happening with trends in elementary school age children. Mm-hmm. So we did a paper, and when we looked overall, we found no difference in suicide rates among young people.
Mm-hmm.
But when we stratified by race, we saw that was driven in part by a decrease in suicide among white children and an increase in suicide among Black children. And in that paper, it was largely driven by an increase in Black males and a decrease in white males.
Mm-hmm.
Although there was a trend for females as well, but it was mainly driven by males. So we did that paper, and then a colleague of mine, Dr. Ariel Sheftal,
Mm-hmm.
my phone is moving. She did a follow-up paper where we used a different database, and we looked at, we compared elementary school age children who died by suicide to early adolescents who died by suicide. So kids who were 5 to 11 compared to kids who were 12 to 14. And we didn't find too many differences. The differences that we did find kind of fell along developmental lines. One thing that we did find, though, is that children who died by suicide were more likely to be diagnosed with ADHD, less likely to be diagnosed with depression. And that was a finding that got picked up. I mean, it was a subgroup. We tried to qualify it, but the media picked up on children who die by suicide more likely to have ADHD, which I would never have written that headline, but that's the way it got picked up.
Yeah, but that's the media.
That's the media, yeah. So then we did a follow-up. We just published a paper earlier this year so when we did that initial study, we didn't specify the age, like we specified an age range of 5 to 11,
Mm-hmm.
Because few studies have looked at children under the age of 12. But we didn't know if that racial disparity in trends, if that continued throughout several more years of adolescence. So what we did most recently is we looked at from 5 to age 17,
Mm-hmm.
and we looked at suicide rates by race, and we looked by race and by sex. And what we found is that there's an age-related racial disparity in suicide rates. So children under 12 years old and younger, Black children have a higher suicide rate compared to white males, but then that pattern flips at age 13 through the rest of life. And our paper was just through 17, but if you looked at the data, it's through the lifespan. so then white individuals would have higher suicide rates. So, I mean, it's really important from a prevention perspective. The fact that Black children in our country have higher suicide rates, even if they're low relative to adolescents,
Right.
We really need to be thinking differently about our prevention messaging, our prevention strategies. So that's where we are right now, and we have a couple studies where we're trying to build off of that initial work, so that we might be able to look at, maybe it's going to be really hard to do this just because it is such a rare event, but trying to understand some mechanisms, some factors that might have changed that that are driving this emerging trend.
Yeah.
So that's some of the work that we're doing right now.
It's amazing work, especially right now. Younger kids, when you think about, I think what I've been seeing is ages 5 to 12. Ages 5 to 12, when you think about developmentally, what do they understand? But and this is happening among them. And even if, even I know you talked about ADHD, that sounds like a misdiagnosis.
I agree. I agree 100%.
Right. But research on ADHD are saying that behaviorally more Black children are being diagnosed and medicated for ADHD. I
agree. We just don't have the data to show that. I mean, I really think that a lot of kids are being, so they could be kids with depression, and we know that kids with depression often will act out behaviorally, and maybe Black children are more likely to be misdiagnosed with ADHD and not given an appropriate diagnosis of depression. And we have to look more at different data sets, but I agree 100%. So that's I mean, and that has come up. Several people since we've published that paper have emailed and have said, hey, you really should be looking at this as a potential factor. And it's hard to think of the right study to tap that, but we're trying. And I wish Ariel Sheftal could have been on the call today too, because we've collaborated together on this. But it's
amazing work. I guess I want to know, like, how do you want? Well, we know how the media, picks up things, but how would you like some of the things that you found to be actually utilized going forward? Like, how can people within the community begin to say, okay, this is major, what should we be doing? How would you like to see your research utilized?
So first of all, I'd like to have more conversations like this, make people aware in the community about this. And then I think some of the best strategies are always developed with community partners. So then it's a matter of let's take it to the community and let's find out, well, what are some of the best strategies to help our young children? Like, what can we do better so that kids aren't thinking about killing themselves at this very young age? Is it programming in school? Is it extra, activities? Is what is it? Are there faith-based things that could happen? So I have to tell you, SAMHSA is putting together a webinar this Thursday. It's the 20th, and so I'm talking, but there are 10 people that are talking from within the communities, bullying prevention people, about what could be done based on these initial findings. So I'm talking from more of a research perspective, but there are people who are presenting, who are in the communities, who do amazing work and can weigh in on this. And I'm happy to send you the link.
Please do.
I will.
Because I think SAMHSA has been doing a lot with adverse childhood experiences. And I do
Yes.
believe that adverse childhood experiences definitely plays a major role in this suicide, you know.
Yes.
It
And
plays,
and I would, yeah, go ahead. I'm sorry, I cut you off.
no, and I was going to say that it plays a major role, but that accompanied with, if you look at urban communities, like the after school activities, the support for the funding for after school activities, a lot of that stuff is missing.
Yep.
And like I said, I grew up raised in Detroit, so I definitely
Uh-huh.
know what's missing, you know.
Yep.
And so because of that, I think all of those things contribute to what we are seeing right now in the data, that they have this pain, they feel hopeless, but they also don't have outlets.
Yep. What are some of your thoughts? Like,
This has been my interest anyway. So when I saw your study to really just confirm like what was going on, is that, I mean, I really just think that so much needs to be done directly within the Black community. I think it has to come out of the Black community. Black agencies, faith-based is a big thing culturally. I think that the approach has to be a cultural approach. It's not going to be the approach or the model that we've been seeing. It has to be a different model.
Yep.
And so definitely having these conversations is important, but we have to get into the schools. I know I talk openly with my kids about everything, because when you have kids, you start to talk about these things.
Yep.
Especially if you're in it and you're researching and you're advocating for it. But my daughter told me, a girl attempted suicide, and immediately the school just said, don't talk about it. Right?
Yeah, and that's the worst thing that can happen.
Don't talk about it. No programming, no nothing, just telling everyone in the school not to. She said, we can't talk about it. And I'm like shocked, like, don't talk about it? That is not going to solve the issue.
Right.
And
that creates more yeah.
That's the initial reaction, though. Even with these younger children, that is the initial reaction. And then with social media and a lot of the things that are coming alive right now with the bullying, like we see what's going on even after the deaths. They can go back and really trace what is going on, but the response, I mean, it's news temporarily. Your findings, it's news temporarily. And so we need to take more steps. So I just really think it's going into the community and really doing something.
Yep. And and I agree. So absolutely going into the communities, and we need more research, because the more that we understand the issues. So we're working on a study now. We're going to try to look at risk factors for suicidal behavior in elementary school age children. And what we want to do is recruit enough. We want to have enough diversity in the sample that we can make some statements about culture. Because a lot of the literature that's out there now is primarily studying white children. So, I mean, we have to change that. And so, but the problem is like, then that becomes 3 to 5 years down the line before you have any findings.
And it's still happening.
And so we can't wait for the research to happen, but they can happen together, I guess, is how I would say it.
So one of the things that I have been really sort of promoting is that, I think what you're saying about the research really goes into this myth that suicide has always been a white issue. And that's just coming from the Black community. It's always been looked at as a white issue. Mental health has always been looked at, as a white issue. And no, it's our issue. It's all of our issue.
Yep. That's right.
So one of the ways is really to start right there. Like, it's a myth that it is an issue of a particular race. It is all of our issue, and we need to all be talking about this and working towards doing something now.
Right.
And the fear, alleviating that fear of even speaking about it. I wrote just a short little article for Prevention Week about how you can start in the community and how Blacks can start in the community. And I used the word suicide. The word suicide was instantly changed.
To what?
Yeah, to children who are experiencing extreme pain. because we are afraid to even say the word suicide. That
yeah,
needs
that
to change. You know,
that has to change.
yes. So one of the things I did see that you wrote, which has been an interest of mine, you guys wrote some commentary or something about 13 Reasons Why.
Uh-huh.
That I thought was really interesting about basically the impact that that show is having.
Mm-hmm.
Can you speak to that a little bit, of your views about that?
Sure. So 13 Reasons Why is based on a book by Jay Asher or some I'm blanking on the author.
Yeah.
But it's story of a girl who dies and leaves behind 13 cassettes, and basically goes through and is blaming some of the other characters. And when the book was published originally in 2007, it was a widely acclaimed book because it was reissued in 2011, but there was no fanfare around. It became a #1 bestseller, but there wasn't the fanfare around the Netflix video. And in part, the Netflix video took some artistic liberty, I would say, in terms of telling the story. And what has happened since it first was released is that there's been an uptick in Google searches, internet searches for suicide related words, for methods, and in particular the method that was used in the story. We've seen in our hospital and in many other hospitals around the country an uptick in kids presenting with suicidal thoughts or behaviors. Mm-hmm. And it's anecdotal, but it all seems to be in relation to the timing of the release of this show. And so we wrote, and there was a study that was done and published in the Orange Journal and Journal of Child and Adolescent, Journal of the American Academy of Child and Adolescent Psychiatry. And Dr. Campo and I were asked to write an editorial about it, and we didn't think it was the best, the most well-done study, but it does point to the issue of the potential impact of this show in particular, and shows like this, on increasing risk of possible contagion in young people. So it remains to be seen because mortality data there's always a lag, usually a couple year lag, and we'll see if the release of this show has had any impact on suicidal behavior or suicide among young people. Mm-hmm. So yeah, it's strong feelings about 13 Reasons Why.
Yeah, I've been seeing a lot of commentary about it. One of the things in watching that, and of course I didn't watch all of it, but in watching many of the episodes, I think I watched season 1. Culturally, things are missing. One of the main things I wondered was the fact that the parents didn't seem to know much of anything.
Yeah.
And the parents' role in it. And my aim or my focus has always been like, okay, what do parents know? And are they equipped to really explore, depression or any of the traits of suicidal ideation? Do they know what hopelessness look like? And so that show, to me, did, show how in some cases parents may be out of the loop.
Yep.
And so what can be done in that area to make sure that the parents are at least in the loop to know what to look for?
Yes. And I would even say, like, the guidance counselor, the mental health professionals, every adult seemed to be out of the loop in that series. And I read the book, and I thought that the book, I mean, again, it kind of had the adults being a little bit out of, like, disconnected from the needs of the kids. Mm-hmm. But I thought that the show kind of elevated that disconnection a little bit. So
yeah, they had to add the drama, right? Make it a little more
yes.
dramatic so the ratings could be up. So you talked a little bit about your next steps, some of the studies that you're working on right now.
Yep.
Hopefully some other things come into place to start bridging the gap and maybe addressing the issue. One of the studies that I'm working on right now is I'm in human services. Most of our students we're preparing our students really to be like gatekeepers. Usually they're doing the intake for different families. Huge. But
huge prevention possibilities with gatekeeper. I mean, that is.
Yeah. And so, but are our students prepared? And so that's what I'm looking at. Are they prepared? How do we make sure they're prepared with the education that we're giving them more in the area of recognizing suicidal ideation, more in the area of being able to talk about it. I'm also doing something where we're working on sort of virtual reality. Getting them comfortable talking to avatar clients, practicing their skills that way.
That's terrific.
Yeah, so I'm hoping that, we can prepare some stronger gatekeepers, because I really don't think, we prepare them with a number of skills, but I don't think we have a specific focus on suicide. And I think that focus needs to be there, because literally they leave us and go out to be case managers who are frontline people, and especially in the urban community, and deal with some of these families. And they need to be prepared and know how to assess whether ideation is there, and what some of the next steps.
Feel comfortable having those conversations, because those are often very frightening conversations to have. If somebody's telling you that they're acutely suicidal, or even if they've had thoughts of suicide, they've made an attempt, how to respond effectively to that is a skill that's learned. So that to the extent that you're addressing that in the curriculum is phenomenal. I mean, that goes so far in terms of building a community of providers that have this skill set. And then the more that we can have folks engaged in this conversation and do it in a constructive way, I really think that's how we're gonna help to reduce suicide rates in our country.
Totally agree. And not just our country. This is a global issue. I was asked to do a training in Jamaica for community people for the University of West Indies on just suicidal ideation, recognizing and responding, with the resources that they have. And they put out a call for just community people, whoever wanted to come. And they had about 75 people register, and we thought it would be like 20 people. But it was nurses, it was teachers, it was principals, it was everyone. Because even though if you look at Jamaica, the rates are very, very low, but the rise is in adolescents, and it's among male adolescents. And so everyone is sort of in a panic on how do we handle this and how do we talk about this. And so globally, whatever we come up with, whatever research comes out, I think it helps other countries as well deal with the same issue. It's a rise among adolescents. It's definitely a rise among people of color. And so we need to address it. So thank you for all you're doing. I'm glad that we spoke, because you helped me to, even though I looked at your study and read your study, but helped me to understand some of the context around what you were doing, which is really great. And then hopefully it'll help our students sort of understand the necessity of this, the necessity of the discussion.
Yep. Well, thanks for reaching out to me, because this has been very nice. And I would love to talk more. So just let me know if you ever want to talk more about this, about some of the work you're doing. And I'll certainly let you know about what we're doing here too. So thank you.
Thank you.
Okay.
All right. Enjoy the rest of your day.
You too. See ya.